Hey guys, I was just reading up about diabetes and the effects that it has on minorities. Did you know that in 2018, the American Diabetes Association reported that 34.2 million Americans have been diagnosed with diabetes, and roughly 7.3 million Americans were still undiagnosed? I also found out that diabetes is the sixth leading cause of death in America and is considered a global epidemic. There are multiple research studies that show type 2 diabetes affecting minorities at a disproportionate rate. There are a lot of variables that went into these studies, such as genetics, cultural, and social economic statuses. By the way, my name is Raylyn Smith, and currently I am a student at West Texas A&M University. In this campaign, I want to discuss the social economic factors that often are dismissed by healthcare facilities, especially healthcare providers. Instead of just diagnosing a patient and saying, hey, you have diabetes and here's your insulin, there should be other solutions and other approach taken for diabetes management. In this campaign, we will discuss these solutions. Yes, diabetes is a global epidemic. But in America, minorities have been affected in alarming rates. The American Diabetes Association reported in 2018 that 12.5% Hispanic, 11.7% African Americans, and 14.7% Native Americans have all been diagnosed with diabetes. It is important for healthcare providers to understand their patients and their lifestyle. Therefore, socioeconomic disadvantages such as food deserts and food swamps should be taken into consideration when diagnosing patients. Food deserts is defined as residential areas with limited access to affordable and nutritious food and is considered one of the leading drivers to obesity. Living in these areas are linked to poor diets because people are less likely to consume fruits and vegetables. Food swamps are described as neighborhoods where fast food and junk foods are easily accessible and heavily populated within a certain radius. And low-income and racial ethnic minorities are more likely to be exposed to unhealthy food retailers. So this is why it is important to consider the social economic factors that affect these diagnoses. As a healthcare provider, you know the community that you serve and you know the patients that you diagnose. There was an article in the Cochrane Review in 2008 that tested out the different approaches to intervention to diabetes education, and it has shown that over a 2-year span, there has been an improvement in diabetes management when there is a education that is centered around the culture of that patient. So instead of traditionally saying, hey, you've been diagnosed, this is what's going on, this is diabetes, you can say, okay, I understand there are social economic factors that you deal with. So food swamps, food deserts, but it's important to eliminate certain foods or try to eat certain foods, and also giving out resources like food banks and just being more cognizant of the environment that these patients are in. The other solution that I would recommend is multiple outreach events. So it is important for healthcare providers to build a relationship with their patients as well as the community, especially when dealing with chronic diseases such as diabetes. Also, there are certain ethnic groups that are not fond of healthcare providers and may even refuse treatment. So these outreach events will help bridge the gap. So creating welcome check-ins where either you, the provider, or the staff will call the patient just to check in on them, see if there are any questions, doing Q&A sessions for the community, because it's not just your patient that you're serving, but as a healthcare facility and provider, you want to make sure that you can also help other members in that community. And one way by doing that is wellness check events. So creating an event where members of the community and the patient can come and receive diabetic eye exam, glucose exam, and also education on diabetes and diabetes management. We know that diabetes is an issue that has a major effect on the American population. Understanding the factors that are contributing to the disease is imperative to manage this disease. Also, acknowledging the fact that food deserts and food swamps are significant problems, especially within the minority population, is important. While we cannot prevent fast food restaurants from opening up in urban areas, we can take preventable actions by providing education. Also, creating viable solutions such as outreach events and cultural training is very important and can help to bring awareness to the disease and the effect that it has on the community. Thank you.